We are good to go.
Oh, thank you. All right, evening, everybody. I'm calling to order our meeting of the Community Services Committee of Common Council on February 16th. It is now 7:05 p.m. And I'll go through our roll call. Barbara Smith is here. Greg Burnett.
Present.
Present. Nicole Ayers.
Here.
And Diana Rivalus.
Here.
And Heidi Alterman.
Here.
And Tom Keegan.
Here.
All right, council members all present. We are all of us on the committee here and ready to go. Want to also point out Mayor Rilling is in attendance. Not part of our official roll call, but welcome. Give you a shout out. And we also have, of course, Chief Lamont Daniels and Health Department Director Deanna Demore and epidemiologist Brian Weeks with us tonight. So I think first order of business is to open up the floor for public comments. Jeff, do we have any folks on Zoom who would like to speak?
Yes, I see one hand up, Diane Loricella. If you, whenever you're ready, I can allow her in.
Very good, thank you.
Okay. Diane, can you hear us?
Yes, thank you. Can you hear me?
Mhm.
Okay, great. Well, good evening, Chairman Johnson and the committee and Mayor Rilling. My name is Diane Loricella for the record. I want to spend just the first minute of my 3 minutes just stating I wanted to thank the mayor and the health director and the council for standing firm with the current mask mandate for indoors. I attended the Board of Ed meeting last night. And I think that we need to get more people to stand as strong as the anti-maskers did to help advocate for a scientific approach and, of course, a transitioning. I'm sure that the plan is to have a map, kind of a map of transitioning out of many of these restrictions, but I don't think we're ready yet. Because of the fact that this is such a this cold weather. So I ask you please to keep that mask mandate at least until March when the weather gets warmer. We still need better mask messaging. And Mr. Weeks' message last month was that the KN95 masks are 80% fake, and that is just not according to my professional background, that there are some very good KN95s for children. They are 94% filtration, the ones that are real. So we would get out a little more information to let people know and give them instruction. They're not professionals. My last minute will be for the Equity and Justice Report. I did get a chance to take a look at it. While I do believe our city had great intention over about a year ago, a little more. I first of all wanted to ask why my name was not on the contributor list. Miss Natalie Price spent quite a bit of time with me and had suggested that there was going to be a special advisory committee that I never heard back from her. On that point, just for content, the section marked environmental, which I'm sure many of you would expect me to dart to right away, does not contain many of the important facets of equity and justice, professionally speaking, on air quality, the location of the air quality threats to the target population and demographic. So I do think that I would lastly just want to say, rightly, our bicycle task force, bike walk task force was turned into a full-bodied commission within 3 months. And that was a wonderful thing. And I applauded the mayor and the council. I do not feel that we need to study how to begin a commission of equity and justice for all. And I really don't understand why the tack was taken. I'm seeing that many now see maybe the inadequate review. But I don't think we need to now hire someone new to start all over again. I think that there are plenty of very willing people to serve on a board or commission. Let's emulate what we did with the Arts Task Force and the Bike Walk Task Force and make them into a commission. Thank you for your time and efforts, everyone.
Thank you, Ms. Lorcella. Who would like to speak next, Jeff? Members have their hands raised.
I'm not seeing anyone else,
Okay.
their hands.
If anyone in the Zoom would like to speak, please use the feature on your Zoom to raise your hand, and we can give you the floor. It's fine if you're also in attendance to watch, obviously. All right, I'll take that as a hearing none, seeing none. All right, so, oh, I see one.
We have, yep, we're
Very good.
on. Okay, hang on. Gail, can you hear us?
Yes, I can. I hope you can hear me because I'm not in the country. I'm actually in South America. So I'm just hoping that you can hear me.
You can.
Thank you for the opportunity to speak. And I wanted to address the Equity and Justice Initiative and as well as the report, because I thought the report had a lot of interesting recommendations that I hope that at least would be taken account of and looked at, because I think Mr. Daniels in one of his comments said that, you know, that I read from your last meeting, talked about the need to hear the voices of the community. You can only hear the voices of the community if you reach them. And I think what is really important is to reach the community. It is not a homogeneous community. It is a community that has different levels. And I think it's really important to look at some of the recommendations on communications that I think are key. That you can only reach people where they are. And finding another group to come in and do work, I think doesn't make sense to some extent, because work on equity and justice is hard work, one, and it takes understanding of the issues before you can just jump in and do it. So if you start with somebody else, they are going to also have to start all over again. So I think what you need to look at is perhaps looking at the recommendations, looking at what you can do, and perhaps finding out what more can be done, especially on areas such as there are lots of things that they have actually flagged for you that I think are important to look at. All the issues, the economic issues that are critical, the education disparities that are huge. I think all those need to be looked at. The whole question of the police Civilian Review Board, I think, again, one of the opportunities lost there is that Connecticut is not the only place that has done this. There are many other examples where it has been done successfully and where people are comfortable with it. It is to move beyond the fear of change. I think that becomes critical to everything else. Moving beyond the fear. We're all fearful of change, but if we remain static, then we won't be able to move forward. So my hope is that you use the recommendations that you have to build on rather than start over. Thank you.
Thank you very much, Ms. Binley-Taylor. I appreciate your comment. Ms. Lorcella's comments. Any other attendees would like to comment? You can just raise your hand on the Zoom. Okay, last call. Hearing none, seeing none. I believe we have some submitted comments via email, and Mr. Daniels, you get to be our featured speaker for this portion. Thank you very much for reading these into the record.
Sure. Good evening again, Madam Chair. Thank you. So I received via the email to myself, ldaniels@norwalksdt.org, 3 emails that have requested to speak on public comment discussion item 4, and I will read them in the order in which they came. For the record, Ms. Gail Binley-Taylor, I also received yours, so I guess I would still need to read that in addition to her comments. Is that accurate? Okay, thank you. Dear Mr. Daniels, I am a 40+ year resident of Norwalk. Having first come to live here in my early 20s, I currently reside in District D, and am an active member of the Race and Social Justice Coalition here. I have voted consistently in city elections and have supported this administration. I was present on the citywide Zoom call that Mayor Rilling called in 2020 in the aftermath of George Floyd's murder in the hands of Minneapolis police officers. What seemed like promising movement forward in that moment has proven to be most disappointing to me, primarily because of the city of Norwalk's neglect and adequately following through on Mayor Rilling's promise to establish some kind of equity and justice commission that could make real progress for the city. I was actively involved in the process initiated led by us. What I observed is that the city's initial one-year contract was short-sighted at best, after taking a full year to produce in the first place. This kind of work needs ongoing commitment. Even worse was curtailing that work at only 6 months. There was little to no transparency on the city's part as to what was happening in that intervening year, nor was there much visible support observed by the city towards its citizens in lifting up and promoting the Led by Us process. I have read the report. I would not characterize it as the city has an incomplete, especially given the lack of full support the city seems to have provided. I remain skeptical that Mayor Rilling and the city of Norwalk's commitment to work toward real, sustained equity and justice is any more than lip service. Again, as a citizen, I am discouraged and disappointed at this juncture. I intend to be virtually present at tonight's meeting. Ann Watkins, 12 Craner Lane, Norwalk, Connecticut. Letter number 2. Hi, Lamont. I just want for a correction. It's Lamont, Lamond, not with a T. Hope you're well. Below our comments, I am submitting for tonight's community meeting. At the original Zoom call in May 2020, which was called by the mayor specifically to address police accountability, there were so many citizens on the call that it lasted over an hour longer than planned. After various organizations requested and were granted a seat at the table, which the mayor promised, we heard nothing for over a year. Despite the mayor's promise, there is still no table which to sit. Why? It took over a year to hire the consulting team from Led by Us, yet when they started operating, the city did nothing to publicize the Led by Us campaign and meetings. Why? Led by Us was giving a wider agenda than that originally promised by the mayor, and the subject of police accountability was virtually buried. Why? Abruptly and secretly, Led by Us was terminated in August 2021 after half their contract time, with no input from those of us who met with them. Why? Even though Led by Us was terminated in August 21, the public wasn't notified until January 2022. Why? That the city didn't publicize tonight's meeting as a service to those many who attended the first and subsequent meetings. Why? I am a citizen of Norwalk and a member of the Race and Social Justice Coalition that has been waiting for close to 2 years for the mayor to carry through on the project which he initiated. I expected transparency and truth from my city government, which hasn't been the case. Equity and justice for all. The title of this non-existent project has become just a noble sounding phrase of empty words. First of all, does the mayor realize that his empty promises and lack of action affect real people who cannot afford rent or food and whose taxpayers' dollars he has wasted on consulting firms? As a citizen, I should expect these questions to be answered not with political talk, but with facts. I should expect the mayor will not blame others. Remember when he blamed Bridgeport for not vetting the police officers properly, but take responsibility for his false promises. I say, quote, end quote, should expect, because given the track record, my questions and those of others will not be answered. Thank you, Bob Giolito. My last and final email that came in this afternoon from Gail Binley Taylor. Mr. Daniels, first I must apologize that this will arrive late. I am currently out of the country in South America and travel today, so I cannot meet your 3-hour deadline. I hope that despite this, you may still find it possible if you find my comments relevant to include them. My organization, the Race and Social Justice Coalition, is one of those consulted by Led by Us, and I personally was able to speak with the consultants as they carried out their work. Having read the report, I am deeply troubled by your remarks that they were fired in large measure because there were differences of approach that were not in the best interest of the community. I would be very interested to find out what those are. There are self-report recommendations that the report makes on governance, on communication, social well-being, the environment, community knowledge, and the changing demographics in Norwalk and its impact on all those areas of our community life. I would be very interested to find out what are the areas of the report with which your office takes exception and why. You have mentioned that you think the community needs to be heard. Well, this report offers many ways for that to happen. I am just totally perplexed by what was found wanting it and would think in the interest of transparency in an effort to encourage greater community participation, especially by people of color at all levels in the society, that is important for us to understand the differences of approach between led by us in your office, as I worry that simply bringing in someone else to finish the work may end up doing more of a disservice if we have not learned from the mistakes or missteps of this process. I hope that the consultants will have looked at the issue of a civilian review board beyond just Connecticut, as there are many examples in other parts of the country where these efforts have been successful. We do not simply need an extension of the 3-person commission, which has absolutely no real transparency, but a review board that would be fair and just and have teeth to truly carry out the oversight work necessary for the community to believe in justice that makes a difference. Best regards, Gail Finley Teller. Madam Chair, this concludes the 3 comments that were sent to me via email this afternoon.
Thank you, Chief Daniels. Do any council members on the committee have correspondence they've received for tonight's meeting relevant to our agenda? No? Okay, I have not as well. Thank you all for your comments. Thank you, Mr. Daniels, for reading those into our record. And I believe that, you know, this public comment from community residents is so important. We want to know what you have to say and we want to hear from you. So this, I imagine, will be part of what we talk about, in the least when we talk about the Equity and Justice for All initiative later on in our meeting this evening. That is coming up as the 4th part of our discussion. So for those who are tuning in, please stay tuned and we will pick up this issue. We are also going to have a lot of other important things to discuss tonight as well. This will be in no small part a big part of our agenda. So thank you all. With that, I want to move on to number 3, approval of the minutes from our meeting held on January 19th, 2022. Do I have a motion? Ms. Ayers, thank you so much, Councilwoman Ayers. Do I have any additions, corrections, deletions for our minutes? I have a few, so I guess I can enter mine in. All right. So on page 1, my name is misspelled. It's Johnson, not, there's an S missing. For the Telesco representative this evening, that's just right on the line. Ms. Laura Cella stated that she sent an email to members and chair, and it should be Johnson. That's on page 1. Page 1 as well. It seems as though, where's that? Oh, yes. Page 1, Chair Johnson accepted receiving the written document. On the second line of that paragraph, it said she will address her request. So there's a missing she will address. Page 2, there is, I think, Chair Johnson asked if, I think it would be if we need to table the minutes until the next meeting. That's at the top of page 2. Also on page 2, under Ms. Smith seconded approval, Ms. Laura Cella's last name is misspelled. And lastly, on page 2, I believe it should be down below under updates from the health department. At the end of that first paragraph, it should say Ms. Damore verbalized past tense her information at this point with ED at the end there. Page 4, the word disease is misspelled. And I'm not seeing in my notes where, but it's, I can come back to that, but that is a misspelled word. And then it looks as though there's also a mask question that I believe one of our comments this evening related to, and I'm not sure what was meant by that. It should be, what is it? Those used previously. I should have written the line on this. I can come back to that one. I guess the mask one, I just wanted a clarification from perhaps Mr. Weeks, you're here.
Yep.
The clarification on the KN95 masks in the minutes at the
Yeah,
bottom.
so I can provide an update in regards
Oh,
to
great.
that, but yeah, it was misrepresented by the individual.
Okay, okay. So in the minutes, should it say he spoke about KN95 masks used previously? Or is it, he spoke about KN95 masks and those used previously? How do we better represent in the minutes what your intent was?
I actually did not receive a copy of the minutes, so.
Oh, goodness, okay. I don't know if I can screen share that right now, because I don't have it on this computer.
Is this something that you guys can maybe table for the next meeting? I'm happy to review it, especially in lieu of the fact that, yes.
Oh, sorry, Diana, you were sounding a little buffered. What was that?
I just said neither did I.
Oh, you didn't? Okay. Okay, well then perhaps, let's see, does everyone else have a copy of the minutes in their packet?
Yes, they were sent to us on the 17th.
Okay,
I have the packet. Don't get me wrong. I just can't find.
oh, the
It could be
minutes.
me, but I just couldn't
Oh,
find
it's
our
okay. I
minutes.
just want to be sure it wasn't everybody. Then perhaps what I'll do is we're going to need to follow up with some of these amendments. So if people have changes to the minutes, you can send them to me. In addition, so Ms. Revolution, you could do that too. Is that okay? And then we can pass them as amended.
Yeah,
With
that's fine.
okay, that sounds great. I'm trying to think. Then maybe we'll do that as well, Mr. Weeks. I can check with you to make sure that it reflects what your intent was before we, yeah. We can
Appreciate it. Thank you.
to attach it to the minutes. Okay, great. Last but not least, let's see, page 5. It's under Ms. Johnson inquired whether the holiday gatherings have caused the fatigue. And there was something about accomplish getting over the variance was another wording that I wanted to address. Just like what the intent was there. Masks are necessary to accomplish, I think, getting over the variance as opposed to get over the variance was what I think the intent was there. And lastly, disease on page 6 is also misspelled. And then on page 7, I saw, and this is in reference to a second firm, so I'm wondering what that meant. And Mr. Daniels, that relates to, I think, something you were saying. I just want to make sure that we got this right. So page 7, it talks about a second firm was selected in April. Was that was the firm that was led by us was selected in April 2020? Is that right?
What paragraph on page 7? Or
Oh,
what
I'm
line?
sorry. Second paragraph on page 7.
The second firm would be led by us, I'm assuming.
Okay. Were they the second or the first? Is that a typo?
They were the second firm. Well, it wasn't selected. We went out, we had to go out for rebid.
Okay. Okay.
So it probably should read that, you know, during the rebidding process, that's when led by us was selected, which was a
Okay.
second time that we went out for rebid.
All right. So we could say the second rebid.
Resulted in choosing the led by us firm.
Okay, that's a great correction. Thank you so much for that clarification. Lastly, on that same page, actually right after that sentence, I wanted to make sure it was Fairfield County Community Foundation as opposed to jury. So community. And I believe also my name is misspelled on that page. I'm not upset about it, just saying. Johnson, it was 1, 2, 3, 4, 5 paragraphs from the end. And then lastly, page 8, Councilwoman Alterman's name is missing an R on the second paragraph on page 8. And that's what I have on that. So
Thank you for noticing.
you're very welcome. All right, any other corrections, additions? I think we're ready. So then we will, I guess, ask for a motion to submit these or approve these minutes as amended with attachments. Does that sound good? Ms. Councilwoman Revelous, is that a yay or is that a, okay, cool. All right, so motion from Ms. Revelous and all in favor? Okay, that would be unanimous, no abstentions, no nays, noes, so that is good. All right, thank you all so much. Now we get to the business at hand, our discussion for this evening. And we've got 5 parts to this, the first of which I figured, because we're going to spend the time on talking about equity and justice for all initiative and some other updates from Community Services Department, we gave you, Mr. Moore and Mr. Weeks, first billing, so you can perhaps enjoy the rest of your evening, should that be what you can do. So thank you all. Mr. Daniel, I can pass it on to you if you'd like to pass it on to them, or we can just get started however you like.
Great. Again, just thank you, and always thank you for allowing me to bring in Deanna and Brian. As you know, we continue to support our community with our COVID response, and always Deanna's leadership and Brian's leadership is really helping us, tread through these times. So without further ado, I'll welcome once again our Health Director, Deanna Demore, and epidemiologist, Mr. Brian Weeks. Thank you very much, Madam Chair.
Thank you very much. Good evening, everyone. We continue to host weekly COVID-19 booster vaccination clinics in coordination with flu vaccine on Thursday afternoons at the health department. And we continue to publicize all the different vaccination opportunities within Norwalk. We're continuing to work with the state health department on the state supported testing site at Shady Beach. So that continues for Norwalk. So we're continuing all that coordination efforts, and we continue to watch the data and provide updates for the mayor for his weekly reports. So Brian's going to be giving his situational update. While we still remain in high levels of transmission, we are seeing the continual decline in cases and test positivity and hospitalization. So we're seeing good trends. So I'm going to pass it on to Brian to give you his update. Thank you.
All right, hey everybody, thank you for that. Let me just share my screen and I'll jump right into the PowerPoint. So obviously this is a common fixture now with this meeting. So as always, I like to just start off, just to remind everybody that this information was pulled as of the afternoon of February 16th, 2022, and is provisional and subject to change. So going to the next slide, as you'll see, this is kind of the typical loadout screen. On the left-hand side, you see the Johns Hopkins University Medicine Coronavirus Resource Center with the global confirmed cases, about 417 million for COVID-19, global deaths, about 5.8 million, US confirmed cases, about 78 million plus, and then US deaths, about 928,000 plus. On the right-hand side here, you see the CDC COVID-19 counties levels of transmission for the last 7 days. So we have 96.34% of all US counties in the high category, which is the highest that the CDC has set based upon this framework, which may be subject to change, but this is relevant as of the data for February 9th through the 15th. So as you can see, Connecticut still in the high for all counties. From there, this is the COVID-19 or SARS-CoV-2, which is the virus that results in COVID-19 disease variant surveillance from the CDC. So they did update it from last time. So they are accounting for BA2 now, which is stealth Omicron that you might have been reading about, and also has been having impacts in other countries, as well as is present in the United States as well, including Connecticut. But as you can see for the United States, it has been growing some presence here in the light pink. The other purple colors are Omicron in general, but BA2 has been now stratified as mentioned. So it's estimated to be about 3.9% of cases relative to the February 6th to 12th week period. But then, obviously the majority just still being Omicron, and Delta being a very small sliver, if not non-existent sliver at this point in time. So if you look at it from a regional perspective, especially for the Northeast, you can see how BA2 has grown some presence, especially on the Eastern Seaboard and the Northeast, but also the West Coast, and it has some presence as well as even in the South and the Midwest. But it is growing territory. It is, from preliminary estimates, estimated to maybe be 1.5 times more infectious than just the garden variety of Omicron that we have been dealing with. And then over here, which will be updated Thursday, is the state health department's surveillance. This goes up to January 29th, but again, just demonstrating the fact that pretty much the majority is Omicron. It is the Omicron show that we have been tuned into. So with that, just looking at the New York Times case averages for the recent 7 days, the rankings that I do, this is data up to yesterday. And as you can see that for especially Connecticut and the surrounding states, we are on that right-hand side of the graphic. So on the lower side, which is really good. But Rhode Island's at number 29 with about a case average of 40.02 per 100,000. Massachusetts is at ranking 42. Connecticut's 45, New York's 46, New Jersey's 49. So we're still nestled near the lower part of the states, especially except for Rhode Island, who's a little bit higher. But definitely our case averages are much lower than where we were, especially even a few weeks ago. And so then also looking at it for the DPH town and city COVID-19 case rates, this is looking at from January 23rd to February 5th. So that 2-week period or 14 days. Norwalk is at 29.8 cases per 100,000, which is above that 15 or more cases per 100,000 of the state's COVID-19 framework. So it puts us in the red along with pretty much everybody else. So that's still holding. And we'll get a new update tomorrow from the state health department and what our situation as well as everybody else's in the state too. Now looking at for the DPH County COVID-associated hospitalizations, this is looking at it from the entirety of the pandemic, so March 2020 to February 16th, so just this evening. As you can see, and I mentioned before in the past, we had a peak in 2020 of 1,972 COVID-associated hospitalizations. This dipped as the summer months came about, so that's the good time in terms of COVID cases as well as management. Then it obviously picked up again. With the holidays in November and December, peaked at 1,269, still held out in January, kind of like what we're dealing with right now in 2022, dipped down, but it did pick up again a little bit in terms of late March, early April. So potentially an impact from spring break and other activities. This is also the opportunity for introduction of the Alpha variant, and so that may be tied to those activities too, giving it more opportunity to enter the country and subsequently other communities, and therefore create that spread that can cause a bump. But then it did decrease in the summertime again, picked up late summer with Delta variant at 380, dipped off a little bit, and then Omicron entered the picture and it really picked up and peaked at 1,939, which now leads us to where we're at, which is a downtrend that has been occurring over the weeks for COVID-associated hospitalizations to the state of Connecticut, which is now leading us to 340. So it's really great news to see that steep decline. So we're getting there in terms of having those lower numbers. So overall, that equates to, for Fairfield, Hartford, New Haven counties being having the most COVID-associated hospitalizations. Fairfield County having 21% of the most recent data, which is 72 hospitalizations. Hartford, 36%, which is the highest, 121, and then New Haven County at 28% with 94. So then moving forward, this is looking at the case totals by week for, again, the entirety of the pandemic for the city of Norwalk specifically. And as you can see, with the beginning of the pandemic, we peaked at 349, dropped off in the summertime, picked up again with the holidays as well as with the new year. And so it went to 582, dropped off. We still had that bump even in Norwalk, like we were seeing with the hospitalization data. So late March, early April, so something to keep an eye on. And so spring break's kind of the name of the game there. And then it dipped off, picked up a little bit with Delta, but then the big game changer, what changed even the scale of this chart, which is why it's got a lot of dead space here, is Omicron, where it peaked at 2,229. So much different from the 582. So, with that high scale of those testing positive, that means it's going to take more time, obviously, for things to decrease. But it has been doing a very steep curve in terms of that decrease. So we're getting there. So again, other great news in regards to what's going on in terms of COVID activity, but nonetheless, very high number of cases. So with that, looking at the big 7 Connecticut cities by population. So again, Bridgeport, Danbury, Hartford, New Haven, Norwalk, Stamford, and Waterbury. The city of Norwalk with the most recent data from the state health department is 29.8, as I mentioned before, per 100,000. So we're kind of in the middle in comparison to everybody else. We also present positivity 8.9%. And again, this data reflective of January 23rd to February 5th. So the lowest is Danbury in comparison. So not that much lower than us, but they are the lowest in terms of the case rate. And then Waterbury being the highest, about 47.4 for the case rate. So for the city of Norwalk specifically, now for the entirety of the pandemic, we're at 21,187 total cases, 253 total deaths. And then looking at age groupings, this is, I think, the important one to emphasize. This is looking at it from January 30th to February 12th, so that's 2 calendar weeks, 14 days. So we still have that bell curve of, say 30, 39, 40, 49, who's usually been the usual suspect in terms of the largest proportion. But the highest proportion this time around is 18% with the less than 10 years of old, 10 years of age group. So I just want to emphasize that, especially in lieu of all the conversations we have been having in regards to schools and young kids. So that is the largest proportion based upon that data set for that time period. But nonetheless, 10 to 19 is at 6.3%. And this kind of segues over to the following slide about vaccination. And so, we have always kind of seen the map for those getting at least the first dose of the COVID-19 vaccine, how it's been relative to each town and city, with the southwestern portion of the state doing obviously better than, say, in comparison to the northeastern portion. But looking at it specifically for Norwalk, the thing I want to highlight here is the 5 to 11-year-old age group. So if you look at it for the fully vaccinated data, you can see how we're at 32.12%. So it's definitely not at the same levels of, say, the 65 plus, which is estimated to be around 100%, right? Because these are census estimates that they're working off of. So there is a margin of error, but this gives us a rough idea. So the majority of them definitely. 45 to 64, 90.72% for fully vaccinated, 25 to 44 for 80.19%. 18 to 24 at 75.78%, and then 12 to 17 at 84.72%. So overall, for all age groups, because obviously COVID doesn't discriminate, it's going to affect who it can get exposed to and obviously have success in terms of infection. So in terms of fully vaccinated for all age groups, it's 77.09%. You have to keep in mind that people haven't all received the vaccine for various reasons, as well as, obviously, especially they're not eligible yet, especially the less than 5 years of age. But nonetheless, I still want to kind of focus back in the 5 to 11-year-old age group, which is not at that level. So it's at 32.12%. The other thing you're seeing here, which is a new addition, the orange, is the additional doses received. So this is data from the state health department that they've been recently processing out. So this gives us an opportunity to look at booster doses, essentially, as well as additional doses that might be applied for individuals that might be considered immunocompromised or immunosuppressed needing it. But it just also gives us a better idea of where we're truly at, because booster dose is another important part of the immunity picture, because we're now pretty much a year plus past when vaccines first became eligible to the general community. Obviously, offsetting for the various age group eligibility that was done in initial stages and still continues today. But as you can see with the boosters, we still have a ways to go to get some other individuals that are eligible for these booster doses up to par, because these booster doses, as the name implies, is increasing that individual's immune response, so that if they do get exposed to COVID, their body can readily combat it and address it in a meaningful way without causing severe illness or other worse outcomes. So that is only at 35.35% relative to all ages in terms of the population. It's not, booster doses aren't eligible for 5 to 11 years old yet, so that's why that one's blank. But it's another important data point and another thing to emphasize in terms of especially getting to normalcy, that we need to really kind of push for these additional doses for these individuals that are eligible for it, to ensure that immunity and the strength of immunity that we do have in the community is still there. So with that, talking about national flu surveillance, flu is still in the picture. It's not as strong as it was with the prior week's report, but it's something else we need to consider, and also another benefit or ancillary benefit of masking. But going to masking, in terms of the prior comments, I just wanted to address, I did keep the original slide content from the previous meeting. So as the CDC has shared on the webpage, the NIOSH approved KN95s, that is an issue. It's something I quoted directly from their website. About 60% of KN95 respirators that NIOSH evaluated during the COVID-19 pandemic in 2020 and 2021 did not meet the requirements that they are intended to meet. So this is quoted straight from the CDC. I even excerpted the actual image from their webpage. It's right here in the bottom. So you can see that language exactly right here. About 60% of KN95 respirators NIOSH evaluated. I mean, I just copied and pasted it. And the link's right here. So the earlier comments, I just wanted to mention was a misrepresentation. I understand one's concern about what that might say to the public, but this is also important information in terms of low performing or counterfeit masks, especially not achieving what advertisers are marketing as, because they are supposed to meet certain industry standards when they release this equipment, especially when people are putting their life on the trusting this equipment too. So it's important to keep that in mind. So I just want to be mindful of those things. You know, obviously there's a lot of information out there, a lot of things to consider, but you know, again, this is quoted straight from the CDC, so I don't know what to tell you. So moving forward, as you can see, city of Norwalk still has COVID testing site, you know, 7 days a week. Please take full advantage of that. If you suspect anybody's experiencing any sort of symptoms, or obviously has been exposed to COVID and you know, maybe also suspects maybe they are developing symptoms too, or concerned, they can get tested. This is PCR testing. So that's really important to emphasize, you know, because this resource is still here in our community and we want to take full advantage of it to address COVID in a meaningful manner and a timely manner too. With this lower case numbers of COVID as it continues downtrending, this is a real opportunity to help mitigate those chains of transmission so we don't kind of go back to square one and start dealing with very high case numbers once more. And on top of that, just advocating for vaccination once more with the link here. So again, all this information is mentioned and quoted in the mayor's weekly COVID-19 report, along with the mayor's letter. So giving new updates about what's going on. So I highly recommend it. Check it out on the city webpage and the social media. Again, comes out every week, every Friday in the afternoon. Just wanted to emphasize that point. And that is my presentation. Thank you, everybody.
Excellent, excellent. I see we already have some questions. Mr. Moore, should we field some questions first and then we can go to you for some other updates? Is that all right? Or
Yeah.
great. Oh, perfect. Yes, Councilman Burnett.
Thank you, Madam Chair. Brian, a question about the B2 variant that you mentioned. You said the impact that it's more infectious. Any other early warning signs of the impact of the B2 variant, which seems to be growing?
Yeah, so we could look at some other countries, specifically Europe, and what BA2 has done with them. As you may have heard, and was also mentioned in the meeting yesterday about how like Denmark has been one of the kind of the countries front and center. Their case rates has been pretty much, you know, when you look at the data that I processed for the World Health Organization, so they're looking at all the countries that report to them, including territories and areas. You know, Denmark is number 2. It's the highest, second highest in terms of COVID numbers, and this is partly because of BA2. So in lieu of that, obviously they loosened restrictions just because they found no way to kind of combat it. I mean, more or less, and they kind of, in some ways, thrown their hands in the air. The way to kind of interpret that. So yeah, BA2 can wreak havoc if obviously, you know, we kind of allow it to in terms of, you know, low vaccination uptake, especially with these boosters, you know, not kind of monitor what the situation is because BA2 is present in Connecticut as well as the United States. You know, Yale as well as other institutions are currently monitoring, you know, in terms of sequencing those specimens to detect it early and see if it's picking up and if it's associated with any sort of, you know, harmful effects in terms of hospitalizations or deaths or outbreaks and things of that nature. So we're also keeping a close eye on it, especially like the CDC has done with that surveillance. So it is concerning because it has about 1.5 times increased infectivity compared to the garden variety of Omicron that we've been dealing with. So yeah, it does pose some issues for concern, given that, like, especially even with Delta, Delta presented in the summertime. So we're not out of the woods yet. And that's the point to emphasize too. And with BA2, it also kind of looms over the whole situation that we hope that we still maintain this downtrend and decreasing COVID activity, but it has potential to be a game changer too.
Great, thank you.
Other questions for Mr. Weeks? I did have one when I saw the data, and I don't want to, you know, put an implication that may not be there together, but when you see the age ranges, do you suppose that the spike in the middle of the age ranges for the 30 to 50-year-olds are because they're typically the their parent age of the young ones who are seeing a spike as well? Do you think that's the connection or one of the connections?
Yeah, I mean, there's a lot of variables that play into this. You know, one could presume with that, you know, the middle age group, you know, they're usually going to be working professionals that may have young or, you know, young individuals in the household too. And so there's a lot of interaction in the community, whether it's the workplace, going out, socializing, things of that nature, but also the kids, yes. And so it sometimes is, you can kind of do the whole deduction, what's the chicken or the egg in this situation, but the kids may get COVID, they bring it into the household, or somebody in the household gets COVID and exposes the kids, and then they, kind of jump back and forth, and then runs the risk of exposure with, say, school setting or other kind of setting as well. So COVID, obviously, like I mentioned, it doesn't discriminate. It's going to affect anybody that gives them an opportunity. And so, with the current discussions about face masks, even with the, vaccines and booster doses and even other prevention measures that, besides that, the more opportunities we give COVID, especially in lieu of still having, case numbers that aren't in the most comfortable setting, we do increase the odds or risks that, again, we might cause an uptick unnecessarily. Just got to be mindful of celebrating prematurely because we're still in the midst of the winter time. Because as evident with the data I shared, there's a seasonality tied to COVID. So as we get closer to the warmer months, COVID does eventually die down. We were very fortunate, especially with even Delta, that it presented in the summertime. Because if you kind of think about this picture differently, if it wasn't Omicron entering the wintertime, it was Delta. You could imagine what sort of situation we had, which would be much worse in the wintertime if Delta was running the show.
Thank you. Any other questions for Mr. Weeks? Thank you so much for your report. Thank you for the work that goes into this weekly. Oh, yes, Councilwoman Rivolu.
It's not a question for Weeks at all, but it was just a comment for you, Chair, actually, just to say that it's really happy that we have you as Chair, so we can really start looking at nutrition and actual ways of combating, especially with diseases that will always have variants. I just wanted to put out that it's very helpful and honestly quite exciting to have you as a chair that will actually look at this part of proactive measures and preventative situations instead of being so reactive to cases that won't change if we don't do something better. So that's all. I just wanted to give a little ups to our chair for being open in looking at nutrition and at a micro level too, so that we will actually give our residents an honest and fighting chance for not only this disease, but all types of different diseases and variants. That's all.
Thank you. I appreciate that. And for everyone else, I know that we talked last time about gardening, community gardening, access to fresh fruits and vegetables. And that's something that we are definitely talking about behind the scenes and trying to figure how we can make some of that initiative a more prominent part of what we're trying to do here. So thank you. One thing I was going to say, and maybe Mr. Moore, we can bring you back in and other updates from the health department. What I know there's a lot of conversation in the community around masking, especially with young people. Do you have any with this new variant that's going through Europe? Is there like any advice you all have from a public health perspective about protecting ourselves? Back to Mr. Burnett's question.
Well, we continue to recommend, masking at this time. We're in, high transmission. So we continue to recommend for people to be wearing a mask when they're in an indoor public setting, when they can't be distant. So that's something, we continue to remind people like what are the measures, right, to protect themselves. Vaccination has been an incredibly powerful tool to protect people and to protect from severe, health outcomes and hospitalization. So we continue to promote vaccination, continue to promote masking. We continue to promote, staying home if you're sick, all the, the quarantine and isolation protocol. So all of the tools that we've had in our toolbox, thinking about ventilation and all of that. So we continue to promote that, washing your hands. So all of that we continue to, I don't know if Brian has anything to add to it, but
yeah, definitely promoting the prevention measures, being mindful, especially what the data is indicating. And again, every data piece forms a full picture. So not one data should be dictating everything. If everything's in alignment and agreement with each other, that's a much better indicator where we're going with COVID. And naturally, the point I always like to emphasize, the city of Norwalk is not a silo. We are at the mercy of our neighboring towns, cities, as well as other activity that occurs in the state, as well as outside of it. And so it's just really important to emphasize that message and keep that in mind. I did want to mention in lieu of the concern with nutrition, what was really cool was a study that did come out of Israel that kind of explored health outcomes relative to vitamin D levels. And so it was indicating that some people had more severe outcomes, including hospitalization and potentially deaths, if they were experiencing low vitamin D levels. And so still, there's some studies that still support that. This was a really interesting one because this was evaluating people's vitamin D levels before infection. So that was kind of the neat thing about it. But it is, one thing that does advocate for being mindful of nutrition, especially in the context of vitamin D. And so we'll probably see more of that in the future as more studies are conducted for that. But I did want to share that because I thought it was really interesting.
That is, thank you. And any type of information you get on that, that's fabulous to share. I appreciate it. What again, is that sunshine? What do we get vitamin D from?
So yeah, your body, obviously converts what's existing in the body from your diet into the active form of vitamin D that benefits us. But you can get it through supplementation and also just diet in general. But that's one way that individuals can boost their vitamin D levels. But also just knowing what their vitamin D levels are. That sometimes comes up during primary care visits. But also if somebody's indoors all the time. And not able to get access to sunlight, and maybe their diet doesn't really adequately supplement them, then they should explore that further and really check with their physicians for that. But it's just important to be mindful of that because it's seen further proof in terms of support that it can reduce severity of outcomes relative to COVID.
That's excellent to hear. Yeah, so if anybody has any tips about what to add to my diet for vitamin D, let me know. That's important. Excellent. And we can share that. All right. Thank you very much, Mr. Weeks. And that's good to know. Mr. Moore, any updates further on, especially health department? What's going on? We'd love to hear.
Sure. So I have a few more quick updates. It's Black History Month. So on social media, we've been putting posts up related to that and to celebrate Black History Month and also for Heart Month. So we've been doing that. So check out our social media. We also distributed 100 radon test kits to residents who had signed up. So we were able to send those out to folks, and we're reminding them and following up about, how to use them and how to test their homes for radon. Next month, March, is National Nutrition Month. So we're also working with food pantries, and we want to get a Know Your Numbers campaign going in community settings to provide free health screenings. And that would include blood pressure, A1C, waist circumference, and body mass index screening, as well as client education and counseling, connecting folks to local health resources and healthcare. So we're working on that now, and we're hoping to start piloting that when the cases are low enough, when we can do that. So we're working on that behind the scenes right now. We're working on getting a SNAP 101 training with End Hunger Connecticut. Also looking to refresh our website with some additional information related to nutrition. So more to come.
That's great to hear. Great to hear. And I think also that radon test kit distribution, that's for free, right? So that was free to residents.
Correct. That was in partnership with the Connecticut Department of Public Health.
Fabulous. Excellent. Any questions people have about initiatives, things coming up or otherwise? Yes, Councilwoman Alterman.
I just had a quick question for Mr. Moore. For people looking for the mental health services, who do they contact? Do they just email you? Is there a link on a website? I don't want to overwhelm you.
Who will we not?
Please explain to people just quickly. A lot of people are struggling during COVID, but also just in life. So if you could just explain quickly how to get them to where they can find services that they might qualify for.
So Councilman Alterman, mental health will fall under me. And so what I would encourage is, I sent this out last week and I'll send it out again, but also encourage the council, for those that are active on social media, I will send you another flyer because I know we presented it in the health and wellness, I forget what it's called, the Health Public Safety Committee. So I will again send that out. We are working with the school. They actually just sent something out this past week. So we will again promote that. But I think the larger issue is that, promoting information, it is out there, but I think we just have to continue to in this case, redundancy is okay because, people need it when they need it. Although the information is out there, you don't use it until you need it. So I will most certainly and we'll also promote it through the city's social media assets as well. We work with the Norwalk partnership that oversees the mental health partnership for the city, and have a really strong partnership. And there's literature and a flyer specifically for Norwalk, both in English and Spanish, that I will certainly be able to provide to you immediately after this session, and also provide that so we can repost it again on our social media.
Thank you.
Excellent. Other questions for the health department? No? Okay, last call. All right, well, looking forward to hearing more about what you're doing next month for Nutrition Month. And it'd be great to get updates on that and push that out on our social media as well. So I know not related, but maybe related. I did see that the library is doing a seed library, which is really amazing. So there's a lot of great stuff going on in the Community Services Department trying to push for this approach to health. That's fabulous. As holistic, that's great. And Mr. Moore, thank you so much always for all that your department does. Mr. Weeks for the information, and so we can make some informed decisions. I appreciate that. All right, everybody. Then that means we move on to 4B, and I'll defer to you, Mr. Daniels, if Mr. Weeks and Demore, I assume they don't need to keep joining us here on this meeting and they can enjoy their evening, but I'll defer to you if you.
Yes, unless you all want to stay on, please, please spend time with your family.
All right.
So, but if you want to stay on, again, thank you to Deanna and Brian for the work that they do continuously in our city. Madam Chair, I wanted to ask if you're okay if I move or make a recommendation to include item E with my update. So then from the equity and justice, that will be the last, I would imagine that will be where the bulk of the discussion will be.
Yes,
so I can kind of incorporate that all together.
Yeah,
if that's okay with you.
It is fine with me. Any objections from the committee about that? Or we're good, then we're good. Yeah, let's do that. Let's move that up into your update. That sounds great. And we're ready for that now. Thank you.
Fantastic. So some of this information that I'll be sharing with you, we will also be promoting it on our social media platforms. I usually tend to share it here first. So if you have any questions or recommendations, I may make some tweaks and then we'll promote that on our social media. So here's one of the big things that I'm not sure if our public knows, that well, many of you may recall that our office facilitated the Unite CT program here in Norwalk. Unite CT is the emergency rental assistance program that Department of Housing received in helping residents receive funding to pay rent. Unfortunately, as of yesterday, because Chair, we were just talking about this last week, as of yesterday, the program has been suspended. So for those that are listening, what does that mean? If you already submitted an application, it will still be reviewed and evaluated to determine whether or not you are approved for financial support for rental assistance that with the understanding that you've been impacted by COVID. And so that's really important. If your application is already in, you will still be evaluated and the determination process will still move forward. Unfortunately, if our residents have not yet completed an application, at this time, they aren't able to. It is my understanding that it may open again, but at this point, it has been suspended. I also want to connect the dots for the Common Council that I presented maybe about 2-3 months ago, where you all supported the community services project where we have the swing space. And so the reason why the swing space is very important because the Urban League of Southern Connecticut, which is located in Stamford, Connecticut, continues to provide office hours here in the city of Norwalk. Why that is important? Because they are the authorized and licensed entity that has access to go into the Unite CT program and help our residents find out where their application is in that process. So Norwalk residents do not have to go to Stamford for that service. So I want to, Madam Chair, if it's okay, to give out that number again. It is a Stamford number, but they'll meet you in Norwalk. And that is the Urban League of Southern Connecticut. The telephone number is 203-561-3993. This is the number for our residents that if you have completed an application and submitted it, I will encourage you to reach out to the Urban League of Southern Connecticut. They can assist you and meet you here in City Hall, because that's where they're located, and make an appointment here in City Hall with you so you don't have to travel to Stamford, and help you find out where you are in that process. They're the only ones, at least in our region, in our community, that can go in the system and literally find out where you are in the process and let you know where things are holed up. So we're really excited about that. And again, I want to thank you, the Common Council, and particularly this committee, helping our department shepherd it for approval, because exactly what we wanted to see is see services that are regionalized provide these services right in our city to remove all barriers. So that's the Unite CT. So giving that, I want to remind our residents that in the city of Norwalk, we have the Office of Human Relations and Fair Rent. The Fair Rent Office is a support service for our residents. This particular service allows for individuals, residents, if you feel that your rent has been unfairly increased, or that the tenant wants to increase, but there's still concerns with the occupation. In the city of Norwalk, you are able to file a complaint, and we have a commission that will hear your complaint and make a ruling, determine whether or not the rent should be increased or the rent can be increased with stipulations. And that number is 203-854-7989. And you can also find this on our city's website, norwalkt.org. Or you can email the Fair Rent Office, fairrent@norwalkt.org. We also have, I want to remind our residents that we have the Norwalk Fair Housing Office, which is led by Margaret Squibb, who is our fair housing officer, gets a little tongue twisted. And this is specifically if you feel that you have been discriminated against because of housing. And I will say, you don't have to make that determination, report it, and then let the support services through the city, through our Fair Housing Office, that can assist you. Margaret Squibb's number is area code 203-854-7820. I know that these are still trying times, and many of our residents are impacted. While many of them have been able to find jobs, we know that many residents are still struggling, trying to make ends meet. So we want our residents to know that through the Community Service Department, we're here to support you. And I think Councilwoman Altman, this is something that I think would be important. I'll share this again through the portal, through social media, that here in the city of Norwalk, we do provide in community services in City Hall, which is the Norwalk Community Services Department. So I apologize to say, absolutely not. They should not be called the health director. What they should be calling is the Resource Support Center. And those of you that were here when I originally came, thank you again, because I always like to connect the dots. When I come before you and ask for requests, I want you to see things are happening. So we do have those 2 part-time community resource specialists, and that's exactly what they are. Our residents can talk to a real live person and say, I need some help. Where do I go? Who do I talk to? So that is the number I want to offer that all residents should be calling, and not calling the health director. And that number is area code 203-854-7999. Again, the Resource Support Center is 203-854-7999. And I often like to say we serve Norwalkers throughout their lifespan, from birth and unfortunately till transition. This is a number Norwalkers should be familiar with. This is a number that Norwalkers should feel they can count on. We have dedicated, and I'm proud to say, bilingual staff, Spanish, and Councilwoman Revelos, we just hired our Haitian Creole. She'll be starting in March. So we're very sensitive to our language, and we're very sensitive to making sure our staff reflect the diversity of our community. And then if you all remember, Sherelle presented about the pod, and I'm excited to say the pod will be delivered tomorrow at the library. And if you all remember, that pod, I have a picture. I don't know if you all can see it. And this is just, well, I'm a social worker by profession, so this is exciting. This is a private area that residents can use, but more importantly, under Sherelle's leadership, seeing the library more just as a place for books, but really seeing it as that hub of our community, that cultural center, that epic center. And for those, many of you all know, especially in again, connecting it back to mental health, even the mental health, through telehealth. So these are private pods, cubbies. I don't even know what the proper name is. It that when residents who may not have the total access for therapy, they can count on their local library to come in. We have internet. We can give them a laptop or iPad, and they can go into that pod and receive their support that they need and so forth. So again, we're just excited. I want to thank you all for approving it way back when, things were happening, because we were told that the port, it was stuck in delivery and wherever it was and all that impacted. So we'll be here at delivery. So I don't know if we need a press conference, but I don't know. I may say, let's just have a press conference for having it here, because I'm just excited about that. And then lastly, I just want to remind our nonprofit leaders and organizations, I'm really excited under Mayor Rowland's administration. He has tasked me that through our ARPA dollars funding, we are committing almost $2 million to our nonprofit community. The nonprofit is certainly is the safety net of our community. And so our city is committed to supporting you. The portal is open. We are now accepting applications, norwalkct.org/ARPA. So it is all online, and it closes on February 25th. You can also see my webinar online that I have walked through the requirements, that I'm walking through the necessary procedures and priorities around that. And I just want to encourage our nonprofits to please apply. I've been receiving many questions. I'm available because it is a federal program, so there are a little bit more rules than normal because it's federal dollars, and we do have to be accountable of how we spend our money, and also be accountable, being able to quantify metrics to say this is the impact we've done. So I just want to thank the mayor in advance for this support, and then I'll be coming back to you for support around the contracts, because as we know, the contracts must go through Common Council in order to award the nonprofits. We have independent reviewers, we have subject matter experts in all the different fields that will be reviewing. So it is truly an independent process, and they'll be scoring. And then we're excited, when you read the legislation, the Biden administration speaks to get the money into the hands of the nonprofits so they can do their work. So we're going to move this as quickly as possible through our process that governs us to make sure we're getting that money in the hands of our nonprofits so they can serve our constituents. I just want to remind our community that the priorities are eviction prevention, homeless interventions, behavior and mental health, which has been an area that I hear literally almost every day, early care and education. And when I talk about early care, providing mental health services to our little ones, they have been impacted just as much as all of us. And workforce initiatives to speak to those that are underemployed or underskilled. We prioritize programs that can help get Norwalkers back to work, to help pay for that certification or get them in that training class. So we're looking for organizations to bring your very best proposal, and let's create programs that can get Norwalkers back to work. And then we cannot forget about our young people, our youth. And so we're excited to offer programs through this funding opportunity to youth programs that serve our young people, especially our most vulnerable, because again, they've been impacted by COVID as well. So this is happening now. Again, the portal closes February 25th at 5 p.m. on the dot, and then we'll start our review process. I'm looking forward to hopefully in April come before this committee to begin the process of sharing with you all who have been selected and to move that to the Common Council for approval. So once the mayor signs those contracts, we can get that money into the organizations. So those are my official updates. Madam Chair, I'll return it back to you.
Thank you so much. Appreciate it. I see we have some questions. Councilwoman Ayers. Oh, we've got you muted, unfortunately.
Look, I hate this thing. Thank you,
It's all
Chairman
right.
Johnson. Mr. Daniels, just a quick question. I'm sure you are familiar with the point in time count that many municipalities in Fairfield County participate in. If you're not,
I know we do that. Well, the city doesn't do that, but I know Open Door does that in terms of the homeless. when we do a point
Okay,
in time for
so-
homeless count.
Okay, so point in time is nationally done, and it's a one particular night that we count our homeless population. When you were talking about fair housing and fair rent and that commission and the work that they were doing with the impact of COVID, I'm sure you do not have it right in front of you, but if you could get the information on exactly what data was collected on that night, usually a municipality has some part in that work. I did it all the time when I worked in Bridgeport. But I would like to see that information so that we as a committee could better gauge what is transpiring with our homeless population. And I know that is done nationally throughout different municipalities. And I believe it's done in January. So that data.
You're absolutely right. We just completed it here in Norwalk.
Okay, so it's not, tonight, I know you don't have it right in front of you, but if you could please get us that information so we could continue to have conversation around our homeless population. Thank you.
Absolutely. Thank you.
Excellent. Yes, Councilmember Burnett, Councilman Burnett.
Thank you, Madam Chair. Chair, Chief Lamont, could you just give that website again for the application? I
Sure.
tried to go out to it and was not successful.
Did I give it right? norwalkt.org/ARPA, ARPA.
Okay, thank you. Thank you for
Yes,
that
sir.
update.
Excellent. Oh, Councilman Keegan. Yes.
Thank you, Madam Chair. Chief Daniels, a question about some of the programs. I'm not sure if they're local or they'd be regional. Do we know of any programs available to our residents that would put them on a pathway to home ownership?
That's a great question. So there are many, again, regional programs that are offered. In fact, Urban League is one of them. We have promoted some of the homeowner programs here in our city. But again, as we've spoken in this committee, it's really trying to find that right match, if you will, of promoting, getting it to the right people so that can take advantage. Unfortunately, the last class that we promoted, it was all done through Zoom because of COVID. And, I believe, maybe that was a barrier to, to do a full six-week session through Zoom. I don't know how many Norwalk residents Councilman Keegan was engaged, but my office tends to promote and help try to support it and get the word out using our city's social media assets. But we definitely do promote the homeowner programs that we're willing to take Norwalk residents.
Well, a couple of us have been speaking about it, myself and Councilwoman Revolou, and I think it's something that we should really put on our radar. And if anybody can do it, Chief Daniels, it's you.
Oh, you put some pressure on me.
It's a little bit.
I like a challenge.
Yeah. Thanks very much.
Sure. Oh, my pleasure. Thank you.
Thanks, Councilman Keegan. Councilman Revolou.
I'd just like to thank my colleague in speaking up about home ownership. And I would just like to add in the workforce development, entrepreneurship. If we can do the same thing for the home ownership supports that we can do for entrepreneurship supports, that would be a big thing. So Lieutenant, what'd you say? Lieutenant Daniels, there you go. Add that.
No, Lieutenant.
I don't even know, but my colleague said, add that. That's it.
Thank you very much.
Diana, I'm working on that with you.
Yes, thank you.
Entrepreneurship, we're working on.
Yes.
Excellent. Yeah, that's right. So should some of the ARPA, do you think entrepreneurship is a viable kind of funding area for the ARPA grants? Chief
Yeah,
Daniel?
well, my colleague under economic development, they're doing some of the small business and incubator work under Jessica. The funding that I'm speaking directly is around nonprofit social services, which we're really excited that ARPA called it out. I mean, its language does literally say nonprofit. So, I just got
Okay.
excited about that. So
Of
I'm,
course.
I'm facilitating the nonprofit social service funding to get out to the community. But my colleague Jessica and Sabrina are working on incubator and businesses and so forth.
I
Excellent.
have a colleague, Smith.
Yeah, Councilwoman.
And I've had a couple conversations with Jessica Vonachek about that, and we'll have some future meetings. As we know, she's going out on maternity leave tomorrow, but Sabrina Church will be talking
Right.
to her. I got you, Diana, don't worry.
I love my colleagues, I tell you.
I think you were pointing to her, right? That's good. All right, excellent. That's fabulous. And I know Mayor Rilling, I see your hand up. You probably want to mention something too about this.
Yeah, just a couple of things. First of all, we do have a model that we've used before with Darlene Young, one of our council people. When we had the Weed and Seed program, we had a program that we worked with local community and local bankers, and we had training, and we helped several people buy their own home. So we already have something in place that we can kind of replicate or maybe modify so that it's updated. But there are some real opportunities to be able to get people into home ownership, and we really ought to explore everything we can. Secondly, it's 8:21 at night, and Lamond is still as excited as he was when he first got hired by this city. I've never met a person with more energy, more dedication. He is so excited about everything that he does, and we are so really happy to have him. We reached out to a cohort in Bridgeport when we were getting ready to hire Lamond. The guy said, "This is the best hire I ever made," because he had hired Lamond for another position. And we really knew right away that he's going to be the guy. And also, I want to give a big shout out to Deanna Diamore and to Brian Weeks. They are amazing. They're on top of everything. They work so hard to make sure they do everything they can to keep all the information out. They give me information virtually on a daily basis to know where we are at any given time. And then we put together the weekly advisories. But I think you can see, and I know I don't have to say it, this team that of Lamond, Deanna, and Brian, just absolutely amazing and such dedicated public servants. And I just thought this might be a good time to say that. So,
Thank you, Mayor.
Anytime's a good time. That's great. And Deanna and Brian, I don't know if you heard that, but you can watch the YouTube and get that. So thank you, Mayor, for that. I know that's, I'm sure, much appreciated because of the hard work that we see in action. I know Chief Daniels talking about things we were doing last term and then seeing them come to fruition. It really does help connect those dots. And my first community services meeting 2 years ago, we talked about the community service call line that you just gave out, and it's now helping people. The pods, being these places people can go or that's happening. So that's really fantastic. And to know that people can not have to travel to Stamford to try to keep their homes, and that's really important too. So
one quick thing I wanted to mention, because I forgot, with the pods in the library, Sherelle is doing a remarkable job. Her new vision, her ideas, she brings something more that is going to advance the library services tremendously, and giving different uses for the library, non-traditional uses where people can go and get the services they need. We're going to be doing the VITA, the volunteer income tax assistance for people making under a certain amount of money, so they can come get their income taxes done for nothing in a matter of an hour. And we're going to be doing that again. But again, putting the right people in the right place, like Sherelle, Lamond, Deanna, and Brian, I think we see some tremendous results.
excellent. Councilwoman Ayers, I see you also have your hand raised.
Yes, I just wanted to say that I really think that we should do some press around these pods. Multiple times people ask about mental health or have questions about mental health. And this is a different way and a secure way to give a service that I think we should really be publicizing around mental health and the care of people who need those services. In addition, the mayor kind of stole what I was saying, but it is what it is. I have to say the direction of our library services as being a hub of communication is really futuristic in its thoughts, and it's going in the right direction. And I am just so very proud and happy to hear all of the wonderful things that are coming out of our library, and all the things that are to come in our library. So I just wanted to encourage you and give a strong recommendation to please do some type of press around it. If it's a press event or anything, I would love to be there, because this is a way people are always asking about mental health, but this is a way that the city is truly addressing the concerns of people that have mental health by giving a service free of charge. So I really think it is worthy of a press conference.
Thank you. I see the mayor already nodding, and we love press events, so we most certainly can make that happen very easily. As soon as it gets here, we were told it's coming tomorrow. Now we have to just wait for it to actually physically be here. But once I know it's here, I told Sherelle, I need to come down and see it with my own eyes. And we most certainly, through the mayor's office, do a presser. I think, to your point, to really highlight some of the unique things and how we're being responsive, it will be very, very powerful. So thank you for that.
And we will make sure we invite all the council people to come and join us, because this is something really, really important. We know what the pandemic has done to people, their emotional, social, their mental health, and we want to be there to try to help them recover to their current previous status. So we'll invite all of you.
Excellent. Thanks, Mayor. Thank you. And I'd have to say too that we have to get Ms. Sherelle on our Community Services Committee at some point, talk about all the good things at length. So we'll try to work that into our schedule.
Absolutely.
Future. Yeah, absolutely. Excellent. So any other questions for Mr. Daniels about his updates? I know you were very efficient, got it all B and C together in one, B, C, and E together in one there. Any other questions, comments before we move on to 4D? All right, I know folks have been waiting on the Zoom, and I appreciate that, and I see you and thank you. I know it's about an hour and a half in, and we are now at our point where we should dedicate the bulk of our discussion to the Equity and Justice for All initiative. Chief Daniels, is there introductory comments you'd like to make, or should we begin with a discussion straight out?
I appreciate it. I just want to say that I know that giving the public comments that were shared today, and those that I've spoken to throughout the city as well, I myself have met different people or have approached me, and I just want to just name it that this is not easy work. I think someone mentioned it's complex, it's difficult, and there's many perspectives of how this should get done. I think that's a fair statement. And I don't think one way is better than the other. I think the challenge is, what is the way that makes sense for our city? So I just want to say again, at least from the perspective I sit in, my office is 100% committed to getting this done, but also committing to getting it done right. And so the question was, what is right? What does right look like? And so I just think it's important that we stay honest and true to a process that has started. I do not consider it dead. Do I see, has it been a little bit derailed? Yes, I would say that. But with anything, you can course correct. I don't know nothing about cars, so I don't even know why I'm even trying to give a car analogy. But I know something about my car. It was a line wrong, because it was starting to swerve. But what did I do? I took it to the shop and they realigned it. So I think we're just in a pivotal moment to just realign. I didn't have to turn my car in. My car wasn't dead. It just needs some realignment. So, as the mayor pointed out, I'm always hopeful. That's my nature, and inspiring. And then I'll say this, I think Deanna characterized it too. It is Black History Month, and I would not be remiss not to acknowledge this. And so I think I've said this before, that while, and I want to thank the residents for accepting me as their Chief of Community Services. And while I personally have sat and participated in this process, I do want the public to know it is personal to me as a person of color. And I personally have been challenged by, unfortunately, the incidences that, which I was quoted on, and I'll say it again, a tough decision to determine that we separated from the consulting team. But we have some documents before us, which you all have received, and it's also been released publicly. And so I think that's what we're going to talk about. And we do have some foundational pieces that were done. For those that were questioning, it's not complete in the sense that there were other tasks. But I think we do have something to work with. I do think we do have something to continue the direction, and I'm looking forward to hearing feedback from you all as the committee, because you all has since had a copy to read it, and looking forward to that discussion. So thank you for allowing me to kind of share some thoughts. But I'll turn it over to you. I think this is the committee discussion, and I'm here to respond to any questions to the best that I can, given the circumstances in which we're in. Thank you, Madam Chair. I appreciate for allowing me to speak.
Well, thank you, Chief Daniels. I appreciate not only your comments, but your dedication to this work and the positive direction you're trying to, as a collaborator, move us in. And I think that's what, I mean, we want to hear from the community. So I feel like this is not the only time for public comment, just to be clear. We can talk a bit about that more maybe in our discussion. But it was very important to hear from our community members as always. And just seeing how you reflect on that, I think is very important. And taking that tone, I'll just start us off by saying, one thing I know we all want is to, we're proactive people. We want to move this in a positive direction with intention and listen to our community. So I guess I'll start us off with maybe some questions to help us, but I want this to be an organic conversation where we can give our impressions, feedback, and ideas around the report as kind of the touchstone. So what I think is useful from this report is my first question, right? Where are the positives for us that we can move forward? I know it could be a big question, but what do we all think is useful from this report now that we've had a chance to digest it? I know it's a big question, and it's 8:30 too, in a busy week. Maybe phrasing it another way, what can we use from it? Are there things we see that we can use from it? I know we've heard from a couple of folks tonight that say that there are some ideas or recommendations in it that could be helpful. Ms. Ayers, thank you, Councilwoman Ayers, for starting us off. Appreciate it.
Only because it was crickets. Y'all know how I feel about that. Y'all talk. Communication is key. So I think in the perspective of using the Blue Ribbon document of 93, in combination with the document that has been provided with us, it is enough material to move. Putting those two documents together, there's enough ground there to move. And I think as I hear in this platform, as well as people who have reached out to me, and I've heard some concerns that they have had, my overarching message is we still have some work to do. Now, what does that work look like? I think that's a conversation. But I think that what we have between those two documents, one thing that just kind of slaps me in the face is that we need someone that is grounded in the city to do the work in helping us move this initiative forward. I think we need to be intentional in our language, but we also need to be careful in our language, because even though this consultation and this initiative started because of something that shook us nationally, there has been things that have happened in the city for years that have put a bad taste in certain residents' mouths. And unfortunately, it took something nationally to kind of push us. But now that we have been fired up, we also need to be ready to go. And in that same light, I would bring to the table that we need to look into maybe a DEI officer in the city to help frame the work of the commission through the framework of the initiatives that have been brought forward in these two documents. And I think that work will help us have longevity, as well as help us direct our next steps. In addition to that, for those people who feel that this is not a robust report, we really need to look at some other data that is at our fingertips. For years, Norwalk Acts has gathered data around many of the issues and things that have been brought up in this documentation, limited in the framework around youth and families. So I think we can also bring that into the conversation. And I'm sure there's other data sources that we can look at to really frame the work of where we want to go. But I think as we are thinking and deciding our next steps, we take all of this data, all of this information, and we do the work. We can't just not do the work. We need to do the work, and we need to hold each other accountable to make sure that that work is done in a way that we all can be proud of.
Thank you, Councilwoman Ayers. I think you've raised some really crucial points, absolutely, and we can pick some of that up further. I know Data Haven, for example, also put out a Norwalk equity profile of all these cities and towns. They did one for Norwalk. That's another great data source, to your point. That's fabulous. What other thoughts do people have about this report in terms of what it could mean for us moving forward? I mean, are there takeaways, even if it's not totally positive, that may help us move forward? I mean, it doesn't all have to be happy, positive kind of things. I don't mean to suggest that, but oh, yes, Councilwoman.
I think Ms. Ayers nailed it for all of us. I think there were, certainly things missing from this report. There were some decent recommendations, but that blue ribbon report, Ms. Ayers, I mean, absolutely, there's a lot of information in that that is usable even now. And that's what's missing from this report. So, I mean, you just nailed it. It's hard to follow up with adding to what you said. So thank you.
All right, well, I don't want to, if anybody just raise your hand on Zoom and I will say, oh yes, Mr. Key, or in real life as much as possible. Thank you, Councilman Key.
Just a couple of things, and I understand the whole idea behind the report. And as Chief Daniels said, that we wanted to get this right. A couple of things struck me though, when we first began doing it, is I thought it was just a real big bite. And by that, I mean, there was a whole bunch of things that we were trying to do all at once. And I think that may have bogged us down a little bit on that. I think as a police officer, I think that what I was focused in mostly was the fact that in Minneapolis, Minnesota, there was this tragic event, and that many people lost trust in their law enforcement community. And for me, that was something that hit home. I took it to heart. And I'm wondering, is there, I don't want to make it simple, because this is not a simple situation. Is there some way that we can get our community to begin, if we've lost trust amongst each other, be it law enforcement or the community in general, are there things that we can do together to regain that trust with one another? And then secondly, there are people in the community, I know they exist. I don't think I have the answers, but sometimes we just need, we know what we got to do, but we just need somebody to help us get there. And what I think everybody on this call, I think there are a lot of people in our community that know what we need to do. We just need kind of like somebody to take us by the hand and help us get there. I'm just trying to figure out who that person or who that group may be. And that's, I mean, I think we're all sincere. I think that there's a certain level of sincerity about doing a good job with this, as Chief Daniel said. We all want to do a good job. I just think we need somebody to help us find our way through this. Thanks.
Thank you, Councilman Keegan. Other thoughts from other committee members? Oh, yes, Councilman Burnett.
Thank you, Madam Chair. As Chief Daniels indicated, this is not easy work. It is not work that you end with solutions the day after you start. It's work that, and if it was that easy, it would be done. It would be long done across the country, across the world. So this is work that takes time. It takes much effort. It takes much thought. Our approach is almost a phased approach, in that the value add of the report is that in some cases it confirmed our belief and understanding of certain situations, and in other cases it did open our eyes to, we definitely need to do more work here in Norwalk. Phase one. Phase two is now, how do we move towards establishing the commission that can utilize the data from this report, as well as the Blue Ribbon Report from 1993, as a springboard? They don't have to start from scratch. They have 2 data points that they can utilize to establish the foundation work that they need to do. And then how do they take it from phase 1 through phase 2 to actual phase 3, which would be execution, implementation, and actually making a difference in the city of Norwalk. So that becomes, I think, a viable approach to how we move forward. Even if we established a commission tomorrow, their work will not end the next day. Their work will only begin. So I guess all that is to say, I know people will say, we're trying to be patient, but our patience is running thin, or our patience is gone. But I guess we're asking, work with us. We are doing work. We're trying to move this down the road. And as stated, we're trying to do it the right way. But more importantly, we're trying to do it in a way that it has impact. And most importantly, that we're trying to do it in a way where it will make a difference. Make a difference for us, make a difference for the generation coming after us. It's just difficult work, but it's valuable work. And I think everyone that is sitting in one of these boxes is 120% committed to making a difference. So, this is where we're moving, and this is our goal.
Thank you, Councilman Burnett. Yes, Councilwoman Revalu.
So the first thing I do want to say, especially being in 2022 right now, is the fact that we shouldn't forget or overlook what has happened right in our own state. And overlooking Lauren Smith, I think her last name was Lauren Smith Fields, and what just recently happened in Bridgeport, let alone halfway across the country, should be paid attention to. I think with the fact that with the both reports, the Blue Ribbon report that was spoken of, the report that we received, and in reading it, especially in the beginning, at first you're like, oh, this is fluff, but then it does come to some points that we do know we've either started working on or need to address, right? But the one place and space that I think, especially with what Councilman Keegan said, is like, especially in that distrust, is I'm still not hearing the community force that can actually be engaged with our police department. And that was a big part of this equity piece. and community, the problems that we received, especially like I say with the equity piece and how over policing has happened to this community or certain communities. I still think that's like we start with one thing and it gets overlooked. Like, I'm just going to use an example. I love you guys, but Norwalk Acts, you started about Black and brown children getting expelled, and we're not talking about that at all. Right now, we were talking about a committee that was supposed to be resident filled that actually oversees what's happening with the police department. That's not being looked at here. So I just want to bring that back up. We have a lot of great points and then again, taking that broader picture, we have bullet points of where to start. And we know, like, for example, sidewalks. We've started sidewalks. We need to address it better, but we know that we've started that, right? So there's like a check mark on how far that could go. But again, what is going on with the community and this, forget me for words, running pregnancy burn, but this committee that should have been residents, you know what I mean, over the police force. And especially when we've had something happen right in our community, not directly Norwalk, but Connecticut. We had something, especially as a Black woman, and how that was overlooked, I think should be seen, dressed, and especially being here can be definitely taken up with our members of the community that's really looking for that task force, that residential task force that oversees what the police are doing here. You know what I mean? I think that would be the first step in feeling like we're addressing this. And then we take this big apple and take these little bites that we need to consume it overall. You know what I mean? But I just think we're overlooking the biggest part of what we were asking, or what the community, the village, was asking for. And that was a residential accountability to the police department. You know, and I just don't think that should be let go or overlooked.
Thank you, Mr. Alous. Before I say a couple words, any other questions or comments, especially from committee members who have not yet had a chance to speak on this specifically?
Chairman Johnson, if I could have a couple of words.
Oh, sure. And then I'll put a pin in my thoughts. Sure. Go ahead, Mr. Mayor.
Yeah, you know, this goes way beyond just the police department. This goes into looking at systemic racism throughout the city of Norwalk and what we can do to identify it and eliminate it, or do the best to mitigate it. My vision for this commission, when I recommended it, was that they are going to be a permanent commission that will look for these things and determine how to do it and how to make things better within the city of Norwalk. We know there are problems. No community is perfect, but I think Norwalk overall is pretty good. We may not do things perfectly, but we try, and we're trying to do everything right. As far as the commission goes, or as far as the led by us goes, hey, look, you know, when you try something new, there's always bound to be hiccups. What we're trying to do now is cure those hiccups and move forward in a way that we anticipated. One of the ways is to form the commission, and we need people in the community to tell us and identify who they think those people should be. Shouldn't be the same old people we always rely on. It should be young people. It should be people who are vetted in the community, people who live the experience, people who know what's going on, because I don't know everything that's going on in the community. I don't know, I've never been a subject of racism, but there are people out there that have. So when I say that we take it a step further, we need to get the commission in place. My thought is then to bring in somebody who can facilitate and train the commission to how they go about their job, because we're going to be bringing people together from various walks of life, people who very well may not have experience in trying to do these kinds of things. And if we can bring in a facilitator to help train the people we put on the commission and get them motivated and work towards these things, and stay with them for a little bit of time until they get up and running. So I firmly believe that if we just try to do it ourselves right now, we may not see the results we want to see. I think we need to get a little bit of help. We had led by us. They gave us a report. There are some recommendations in there. As Ms. Revolus mentioned, there is the report, the Blue Ribbon Commission report from '93 that has some good thoughts and ideas in there, but we need to help the people that we're going to put on that commission. We need to help them get up and running and help them understand how to do their job and to who they can rely on, the things we expect of them. I expect of them to not only hear from the people what problems are, but I expect them to identify systemic racism by going out and looking at things on their own. So we need to have that in place, but I think we need to have somebody to help train them, somebody to help stand by them until they get up and running on their own, and then we can move forward. So that's my thought.
Thank you, Mr. Mayor. Yes, Councilwoman Ayers.
So that's why I suggested the DEI officer. Where me and the mayor agree is that the people on the commission, because live experience, your walk in life, that all brings texture to this type of work. And when you're looking at things in a context of systematic racism, that work alone, if we were looking at nothing else, is decades worth of systems working against people. So you cannot necessarily put a timestamp on changing culture and changing norms. I would suggest that the person, some people are calling it a facilitator, I'm calling it a diversity officer, needs not to have a timestamp on them. Because when you start to scratch the surface and some of these things are revealed, you need a qualified person to help get people through the process and get the community through the healing process. You cannot just bring somebody on for 6 months to train people and then they walk away. We are setting ourselves up to fail. So when we are looking at the longevity of this commission, we need to tie to that conversation a position that will also have longevity, that could continue the work. Because looking at the problem is the first step, but actually addressing the problem and addressing healing and making cultural changes, that is going to happen over a process of years. And so I think just gleaning from the information that was given in the 2 reports, we need to make a system or formulate a system that will allow us to give resources to a person that can drive this with the support or the framework of the commission.
Ms. Ayers, I won't say, like, I absolutely agree with that. I don't want to say too much because Ms. Revolus is speaking next, but that is, to me, such a convincing, compelling argument for having a long-term plan to have a diversity, equity, and inclusion officer in our city government. Absolutely.
This don't wash off. I get up and you see this beauty all day. And so because this doesn't wash off, my live experience cannot be wiped away in 6 months. Systematic racism has been a fabric of the United States since its inception. So we would sell ourselves short to think that we can solve this in a time frame of 6 months, 12 months, 24 months. These are big systems that we're talking about. We're talking about our police system. We're talking about our educational system. We're talking about our governmental system. It takes time to address this, but I do believe that with the right person to guide the work and to be a sounding block for the work, we can start this work. We could begin to change the narrative and begin to address some of the things that pulls us apart instead of brings us together. I'm sorry, Diana, you go. I'm sorry.
No, don't be sorry. No, you guys.
No, don't be sorry at all. No. First of all, what I wanted to say is 2 things. Like my colleague, Councilwoman Ayers, was the one who brought up the ribbon report first. I was just doubling back on her. I just don't take anything that she just brought up. Secondly, I'm 100% on what she said. I just want to say, in that we do need someone. I think we overlook the lived experience all the time, right? And the person or the persons who should guide this. And a lot of times, even in your systematic ways of thinking, you want the person with the degree, but you don't get the person who lived it, who sees it, who does it every day, who's gone to jail, who's come back out and who's helping kids, but you won't hire him, but they're supporting residents right on a grassroots level. Like, the only thing I would say is don't overestimate the lived experience and the people you have in this town. Speak to those people, speak to those residents, like we're going to say, and we can have someone that you may not expect, even though it's needed. I'm just saying, who you want to fill in those spaces, again, can be systematic in your thinking, and just don't overlook lived experience in your community, because your community is the one voicing these inequities. Your communities are the one who's also experienced this for a while. And like she said, I can't rub this off, right? I live this beauty. Right. So it's a lived experience that literally started by the age of 6, when it becomes very aware that you're a Black person, you know? So that right there, I'm just saying, on the side of things, when we do get this person that helps in helping this commission, just don't overlook the lived experience or your residents that are right here in the community, and have them be here, that live here, right? That will be a part of that longevity and seeing those changes a year, 2 years, 5 years down the line. That's all.
Thank you. I'm hearing a lot of amazing kind of insight about this. I've been facilitating, so I've been wanting to jump in, but I've kept myself from doing that, because I think we'll keep the flow going. But a couple things come to my mind based on public comment this evening, talking with community members, talking with you all, hearing what you have to say tonight. And the first is I think, we touched on it, but correct me if I'm wrong, Chief Lamond, that this, Chief Daniels, is that this commission is just one part of a bigger initiative. Is that right? That's correctly?
That is correct,
Okay.
Madam Chair Johnson. And it, if it's okay, because I know, because the public has, well, what happened, and we made an agreement with the organization that we're going to separate amicable. But one thing I can share is that when you hire a consultant, I think Councilman, or maybe Councilman Keegan kind of alluded to this, it definitely was an ambitious plan. But when you work with a consultant, the relationship is that we create this ambitious plan, and then you let us know if you can do it. So there was an agreement that it can be done. So we supported with the allocated resources at the time. The agreement in the contract that was settled was that this can get done. I think the other thing is to point out that the project that the mayor committed to, it's the Equity and Justice for All initiative. To your point, the commission was just one deliverable. And as we all know, we separated. However, it's important for you, the committee, and the public to know, we also relied on the consulting team. They decided the actual scope of work and in the manner of what areas that they would do. They decided that the police interaction component, they wanted to wait later on. So it's not the city failed. It was a part of the process that when you engage in a consulting team during that initial meeting, you talk about what does that timeline look like. They shared with us that the police piece, they will do that in phase Q4. Well, obviously we didn't get to Q4, because if they were still here, they would still be with us. So there's a lot of misperceptions of what happened. And I'm not at liberty to kind of go into detail, because we made a commitment that, with them, for us, that we agreed and we separated. But it's important for the public to know that there was an outline that was agreed upon based on their ability to deliver that they created. So, and we as the contractee or contractor agreed that based on, because they're the experts, to Councilman Keegan, you know, we hired them and they said, well, we want to do it this way. And we supported that. There was no reason why not to support that. So the commission was a deliverable. The police interaction is another deliverable that did not happen. Another deliverable was also to do an equity analysis here in city government, because the mayor has committed that if we're going to do this stuff outside, the mayor has always said to me, Lamont, we gotta clean in-house too, or look in-house too. So, but that piece didn't get done based on the timeline. Their timeline was this community engagement piece that you all have. And so that's where we left it at.
Thank you very much for that clarification. I think that really helps paint the context there. Oh, Ms. Revelous, your hand up still, or was that from before?
I just realized it was still up when the mayor did that. I'm sorry.
Oh, it's okay. Would you like,
Yeah, no.
or are you?
I'm good. I'm okay. I'm good. And thank you for saying that, Lamont, for clarifying that, please.
Thank you.
I'm good.
Oh, we're good. Excellent. Yes, Mr. Mayor. Oh, you're on mute, sir.
Yep. I just want to make one more comment and then I'm finished. We've done two things. Well, we've done a lot more than two things, but we've done two things that people looking in from the outside said, you know, the courage that Norwalk has is absolutely refreshing. We brought in an efficiency study to determine where we can do better and how we can either do things more efficiently, work together with the Board of Education, share resources, eliminate redundancies, do all the things that we need to do. And when we brought the people in, they say, you know, we've never had a city that opens up their books, opens up their team to trying to make things better. And we think that that's really remarkable. When we, when I brought in the idea of forming an Equity and Justice Commission for all, people are saying, you know what? That's courageous to open up the city of Norwalk and to look where you're failing the most vulnerable community and how you can do better. And that's what this is all about. Norwalk has always been bold in trying to take this introspective look and see, you know what? We know we can do better. When I was the police chief, and we brought in a team of assessors from the Commission on Accreditation, we'd have a meeting at the end of what they found. I said, you know, we know that we do things well. We know there are a lot of things we do well. What we need you to tell us is what we don't do so well or what we can do better. That's what's good. That's what's going to help me. That's what's going to help our department. And that's what's going to help our city. When people come in from the outside, put together a report and tell us, look, this is not good. This is not good. And here's how you can do better. That's what this is all about. Just trying to make the city of Norwalk more inclusive, better, and helping people who have for years and decades been disenfranchised, not only in Norwalk, but wherever they've lived. And I was looking to say, you know what? People who look at what we're doing could then replicate what we are doing and say, hey, Norwalk did it. We should be able to do it too. And that's what this is all about. You know, like I said before, there's going to be hiccups when you try a new process. You drink some water and you cure the hiccups and you move on. And you figure out what comes next. I like Nicole's idea of the DEI person, somebody that can come in and work with us. And you know, when I said 6 months and hold their hand and get them up and running, you brought up a better idea. Bring somebody in who can work with them permanently. A staff person, somebody who's going to guide them, somebody's going to help them do the research, somebody's going to help them go out into the community and answer or ask the questions that a lot of communities don't want to ask. We're not afraid to ask the questions. We know there are a lot of things we can do better. So that's my pitch, and that's why we did it. And, Lamond has been a champion in trying to work this through. He kept me abreast of things that were happening, but more importantly, he kept me abreast of things that were not happening. And that's where we said, you know what, we got this far. We've made it halfway. We have a lot more to do. So again, I thank everybody for their time. And I think it's time for me to have dinner. And you too, all of you too.
That's a late dinner, Mayor. Thank you for your input. Ms. Smith, do you have a comment? Yeah.
Before you leave, Mayor, thank you. And yeah, Ms. Ayers, this is a great idea, and thank you for making that commitment to that position, Mayor.
Yes, we would definitely love to hear more about how to follow up on that, because I think that's an excellent idea. Absolutely. Well, thank you, Mayor. Appreciate it. And he's off to dinner. So I want to note for the record that I believe Ms. Alterman left the Zoom. I don't know exactly when, but I noticed it sometime before 9 o'clock, but I don't know if we need to put that in the record or not. I haven't texted her to see if she had to step off. So yes, thank you, Mr. Mayor. In the spirit of that, a couple of things that I wanted to add as committee member now, putting my hat on, is this idea of ongoing community conversation and collaboration, how this is an ongoing process. And we know that with equity, there unfortunately may never be an end date, though we can hope for that. But with this notion, I really think we can try, Mayor, while you're here before you go off to dinner, hopefully we can use some of the communications director to get the word out about the report. Possibly, maybe we can have more public comment at our next meeting on March 16th. Does that sound like an idea that's possible too?
I've got a great announcement.
Oh, great.
I had a leadership meeting today and I talked to the leadership. We have selected a new communications director. She's amazing. She has a master's degree. She's working now, well, maybe I shouldn't be saying this. She's working now at a very, very high level place. She is fluent in Spanish, has a wonderful, wonderful background of experience, and we're so excited to bring her on. I interviewed her last week, and I interviewed the two finalists, and I immediately knew that this was the right person for the job. So I think you're all going to be pleased when we present her for your consideration. But yes, we want to get her on sooner rather than later. And I, like Ms. Smith went like this, don't tell where she's working right now because maybe her boss doesn't know she's leaving. So, but anyway, we're excited about that. And I think we're going to have a wonderful person who can get information out to the community. Josh did a wonderful job. I think we're able to take it maybe one step to the next level because of her past experience. So, yeah.
Okay. Oh, Ms. Rivers, a question? Yeah.
That sounds amazing. But here's the thing about communication. You have several different languages in this town. So she's fluent in Spanish, I get it. But how often are, again, bringing processes or people like the language line to fully communicate? And I'm not even going to, because I'm going to be thinking about Creole speakers, but like we have Portuguese speakers here. Like, if we're talking about communication, how are we equitably communicating with everyone?
Well, as you mentioned, we do have the language line, and we've trained some of our department heads and others at how to effectively use that. It's not being put to the use that we would hope, and we need to do a better job. I believe, if memory serves me correctly, they provide over 200 languages.
Yes.
And if we encounter a person who's having difficulty communicating, it's such an easy thing to dial into that line. It's just we have to make better use of it. I agree. We're not using it as effectively as we could. But hopefully, and again, this is one thing that Equity and Justice Commission can focus on. Look, let's be inclusive. We need to include everybody. There are what, Ms. Smith, what is there, 42 languages you spoken in the
Like
Norwalk Public Schools?
62, like 62.
Yeah.
So these are the kinds of things that we need to identify and determine how we work through that. And how we get people included and get them involved in the city, get them involved in the community, get them involved in taking advantage of all the different things we have to offer. We have a tremendous amount to offer. I mean, Lamont is bringing services that were in Bridgeport or Stanford, he's bringing them back into Norwalk and making it available to people so they don't have to travel to Stanford or travel to Bridgeport. We want to get the courthouse opened in Norwalk so the people that have to go to court don't have to drive to Stanford every day. I mean, it's a horrible, horrible thing. So these are the kinds of things that I expect this Equity and Justice Task Force to focus on. They may be small things to us, or they may seem small, but they're not small to the people who need those services. Those are the things that people need. So I
Mayor,
think,
do you think that, do you think, or do you, that we could ever get like someone who sits, because, you know, there's a representative for Connecticut. Do you think we can get that person to come and sit on, like, I don't know which panel, I don't know which committee, but maybe getting a representative from that to then equate their services more exclusively with Norwalk, maybe help with our pricing, so on and so forth. Just wondering if, are we open to that at all?
from the language line?
Yeah, from the language line.
Yeah, absolutely, because that,
Okay.
and that's a great idea, because we spend money on that. We have that service,
Right.
we pay every month, and maybe our training isn't resonating with some of the department heads and others who might have to use it. So if we bring in somebody and bring all the department heads into a training program, bring the council people into a training program and have them explain the whole idea about the language line and what their services provide and how we can make better use of them. I think that's a really good idea. Lamont, you better write that down and get it done. You have a better job now.
Well,
Thanks to
Mayor,
Miss Revolute.
I didn't want to interrupt you, that we actually, part of our reorg, I just met with our HR director and our ADA specialist. Part of their assignment will be to oversee the language to promote it bigger and wider. So we're just now going through the HR process. So we will have a dedicated staff person under our administration to monitor, promote, training, and really keep that before us, Councilwoman. So I didn't want to interrupt my boss, but I just literally spoke with Ray Bernier, HR director, and we're revising the job description literally in real time as we speak.
You know what doesn't surprise me is Lamont already was on top of this.
Do you think that in work, and my last thing, do you think, before I ask for the motion, but do you think,
not yet, 'cause I have to
no,
say a couple
that's
things.
why I was just joking. I'm just
All
playing.
right,
I said, but do you think, like I was just saying, having someone that's a representative from that language line can help us with the rates of service? That's a straight up question. Just wondering if they're from there to help us in utilizing their services to its fullest. Can it help us in rates? Just wondering.
Absolutely. I mean, we partner with all our state agencies to help support and provide. So this would just be the same process, Councilman Revelos, that once this person is hired, the expectation is to connect with resources locally, regionally, and statewide to ensure our residents are being served and we are trained at the top of the line.
Well, what I mean is in using, like when you get that person, you bring the language line to the table, right? With having them equate for cheaper services and using them more for Norwalk overall, like in us paying the bill. That's more what I mean.
Oh, we would have to look at that. I see what you're saying. We would have to look at that and explore that.
Okay, all right, thank you.
Like
That's
the
all my
economy of
questions.
Sales, where the more you use it, the less it costs.
Right, exactly. That's what I mean. That's what I mean.
Got it.
Excellent.
Okay.
And this just came across my inbox, a couple of community members who've been trying to advocate for folks showing up and knowing that there needed to be some better training. So that's fabulous. And Mayor, we will follow up with you about using your communications department to get the word out on the report so we can hear more feedback from the community. We can definitely do a follow-up over the next couple weeks with you if that sounds like a plan.
Yep.
Now you should go eat dinner, sir. I have a couple things I want to pose as our closing here, if that's
It's in the oven and I can smell it.
all
That's what's
right.
bad. That's what's so bad.
All right. Well, I don't want to keep you from that. You
All
gotta-
right, take care.
Thank you, sir. All right. All right. One thing I thought, we'll just pivot real quick, like to an endpoint for tonight, because we're at 9:15. One more thing I was thinking was, this commission, as we've been talking about it being what sounds like the next step to me, right? Means that inevitably the ordinance committee will have to come into play because this commission needs to be created by ordinance, right? I believe I'm the only member of this committee, and Tom Keegan, you're the only member of both committees. So the two of us will be part of that on both sides. But so what I'm thinking is, in the least, we have some ordinance members come to our March meeting if we're going to talk about this at length, which I think the next step should be, okay, so what is the scope, maybe the duties and powers of this commission? We give some input on that in concert with the mayor's office, obviously, in concert with Chief Daniels, so that then the ordinance committee, either in April or perhaps May, have something to work off of that's based in the expertise and experiences of our community as well, of our committee as well. What do you all think about that idea? Does that sound like a plan in some way? Or should I piece that out a bit more?
Madam Chair, I think
Yeah.
that's fine, but I also think there's some things that we can also be doing in those recommendations. Some of those recommendations need to be deferred to other city departments. I don't know why we need to wait to do that for a whole 30 days. I think what we can use, we should use, and then you could continue to work on what you just spoke about.
Okay, yes, Councilwoman Smith.
I was just going to add that we know that the ordinance needs to be created in order to move this forward. So absolutely, let's get that going.
And just double backing on what Councilwoman Nicole said, that's what I mean. Like, a lot of these points we've already started or know or have some type of process. So if we can kind of get that to whomever we can get that to now, but I think it's a great idea to have ordinance come as well.
Okay, excellent. So I feel like there's two tracks we can do. The first is getting a couple of us to maybe work. I mean, obviously, Mr. Keegan and I will be part of it no matter what, but like getting a couple of us in addition to work on that scope piece for the commission. Then, so we have something to talk about in March, and then the ordinance folks can come and learn on that piece. Secondly, I'm wondering what we do with regard to your suggestion, Ms. Ayers. Chief Daniels, does that mean we, as council members, can send to the mayor's office initiatives we think should be taken up by departments?
I think through you, Madam Chair, I think what I would recommend is through this committee, you are recommending that my office now moves forward, because we were waiting for this discussion, to really identify those low-hanging fruit and opportunities that will be shepherded through the mayor's office, so that we then internally could work through the mayor's office and primarily through the cabinet, which I serve as a cabinet member, to start thoroughly looking at the report and identifying what are those opportunities that make sense to Councilwoman Revelos. What are things that are already happening that just need to be strengthened and enhanced or tweaked, or to say we are doing this, and then this committee serves as that reporting body that I can then report to around looking at the document, because I haven't read the document since initially, to the point, I'm sure those you all would probably agree, there's things that we could do now, there's things that may have to be a resource allocation, there's things that we may have to do some future planning, but we definitely can layer it maybe in those kind of buckets to really see what is possible. So the community knows that we are still serious and we are committed, but we also recognize the different forces that, that are there in order to get things done. But we certainly should make a concerted effort to look at the document and see what can we get done now.
Okay, that's excellent to hear. So that cabinet levels will be referring to the document, reading it, thinking about what that means for their own work, DEI work in particular. Okay. So I guess what that means is we can, as council committee members, send those low-hanging fruit, so to speak, to you, Chief Daniels, or should it be through me and then I compile and give to you? What works best?
Probably through you, but I just want to caution, I think I would definitely, the mayor is not here. I think, I think the mayor's office definitely should be consulted or very much involved in terms of outlining work to different departments.
Right. That's not our, I get that's not our.
Right.
purview. That's correct.
But I as the staff person for this committee, can report back, we'll report back to you all where we are and where we think makes the most sense from a department perspective, because all the departments have their own different, capacities and so forth. But most certainly, the commitment that I want to leave with the public is that we will take the document based on this meeting. If you also are recommending to then discuss it at the cabinet level, so we can start really looking at it thoroughly and looking at those opportunities. I think everyone's saying, what are those low hanging fruits that we can really move on?
Yes, Ms. Ayers. Yes, Councilwoman Ayers.
Mr. Daniels gonna be so mad at me.
Uh-oh.
Ooh. One of the recommendations, you'll be all right. One of the recommendations was for community charrettes. That does not necessarily live in a particular department. I would love to hear Mr. Daniels' ideas of how we could really make that happen, because that starts the conversation and that allows community people to be a part of the conversation by having those charrettes. And I know the hour is late, but I would be remiss if I did not bring that up.
Well, I am pro charrettes, because that's how you get people involved. I think the question that would be raised is that through this committee, will you all support to us to hire someone to help support that work? I think we were talking about you need someone to guide the conversation, and best practices. It shouldn't be. I mean, all the different reports that we've done, we've hired consultants. The POC, the Transportation Master Plan that is happening right now, those are consultants that's guiding those discussions and work. And so, and I think the other point is, will people feel comfortable having a city person engage in conversation? We talked about trust and what those perceived perceptions are. And I know that that word is very sensitive right now. And I think, Councilman Keegan said, we need help, but not help from a sign of weakness, but help to support this work. And there are people with specific expertise that do this. And I don't want this bad experience to cloud that there are consultants out there that can really do this work very well, which is my recommendation.
Any other thoughts on that before? I think we have a sense of us kind of identifying low-hanging fruit as just purely as here's what the committee thinks just as is to you, but then you taking this to the chiefs. I think, is it fair? We don't vote on it, but is the general sense that everyone is supportive of that move to take for Ms. Chief Daniels to take this to the chiefs, the cabinet? I'm seeing a lot of head shaking. All right, for low hanging fruit purposes. Okay. So there you are, Chief Daniels. There's there that is. And then the next piece, I think, obviously we'll take the ordinance piece, and then we'll have to talk next about what does this look like? Is it a DEI officer? I know obviously that would require, what we're talking about is funding. What does this all mean? So that's something perhaps we can take up if we're ready at our March meeting, depending where we are in the process. I think we'll be in touch, Chief Daniels, about what that's looking like once you take it to the mayor's office and his cabinet. Excellent. Last thing, just to tell the folks who, bless you for staying this long, email any of us, Mr. Daniels obviously included, with more feedback after you've had time to read that report. If you're listening, if that gets picked up by the press, please email us your thoughts and comments in the meantime between now and the 16th of March, any of us, and we can also read that into the record. If you can't make that meeting, we'd like that ongoing community feedback. So any other final thoughts, or am I looking for that motion?
Motion to adjourn?
That's what it is. All right, all
Oh,
right.
what did,
All
oh,
in
but-
favor? I will accept that motion, Ms. Rivers, unless someone, the hand was for something else. I think it was. for-
yeah, I was just gonna say, was the hand for something else, Tom? Or Keegan? Sorry, no?
I will say this as a final farewell. We did not have a language line in my police career. I had a fellow that I had to question that only spoke Greek. I took him to the diner and got an interpreter there. It cost me breakfast too. Jeez.
You know, sidebar, just real quick. And I did that motion. It's out there,
It's
but
on the table.
but one of the stories that I even particularly why I say that is because in the courthouse, I actually watched a family who kept getting their case prolonged because nobody could speak Polish.
Yeah, I believe that.
You know what I mean? So again, just saying that, I know I talk about Creole a lot, but you know, we have several languages and we have places and families that don't get their services because no one speaks that language. But anyway, not to push that motion, still out there, motion.
No, I'm so glad you raised up the language line, Councilman. Thank you. And that's you, Mr. Keegan. We're good. I will say all in favor of the motion on the table to adjourn. Excellent. Fabulous night. Thank you all so much.
Good night,
for this
everyone. Thank you.
conversation.
Good night, guys.
Good night, all.
Good night.